As a disclaimer, anything discussed here is just meant for health education, not meant to be personal medical advice. And what we talk here is just based on collective clinical experience and current scientific literature. So today, unfortunately, we had to reschedule the stroke presentation. So instead, we wanted to have an open discussion moderated by one of our consultants, Jordan Hamlin. Jordan has graduated with a BA in psychology from Georgia State University, and she's been working as a neurofeedback technician and received her BCIA certification in 2022. She's also a certified heart math trainer, and has been researching the impact of light on the human body since 2020. And she is going to talk about pulse frequencies, entrainment, what are we impacting? We'll try to get through all these points, but we're not going to wait and have questions at the very end. Just anytime you have a question, please bring it up. Raise your hand and we'll call on you.
Hi. So I'm really excited to have this opportunity. These are a lot of the topics that I think are really interesting, but also are important things to discuss in this field. So as Brooke said, please just feel free to bring up your ideas at any point. It's not as structured, but I'm going to present a couple of cases or research topics that have come up, and then have a slide where I open it up for people to discuss. And hopefully you find these interesting too. So the first one I think that's important to talk about is pulse frequencies. So I put this in here that I like my music around 80 beats per minute. My father is a deadhead and he also enjoys music that tends to be around 80 beats per minute. I put that in there as possibly saying that there's a personal preference about what frequencies could be best. So here in the first study, this was a study that was comparing constant wave, 40 hertz, 100 hertz, and sham treatment. The wavelengths were 660 and 850. People were assigned to one group or the other for each of these wavelengths. They weren't used in combination during this. And they showed that the pulse waves had more and better results. So something that goes along with our idea of how we picture photobiomodulation. The second study that's on here was comparing just 810 nanometer with constant wave, a 10 hertz pulse, and 100 hertz pulse rate. And they showed that 10 hertz was more effective. So this is where we get our basis for using 10 hertz, 40 hertz, or constant wave, is from these general ideas. However, this study had decided that based on these previously presented articles, that they were going to choose 73 hertz, 587, and 1,175 hertz pulse rates. Feels like it was quite a bit of a jump from the previous ones of 10 and 40, but they decided to go this route. They found that there was significant increase in 6 of the 15 neuropsychological scales, and they also showed there was 8 of 12 of them had an increased regional cerebral blood flow. And what was interesting with that is there were 4 people who didn't have a significant increase in blood flow, and these 4 individuals had multiple blast injuries. So a weird thing to note, but it was the only thing they seemed to have in common. So I have a slightly blurry image of this here, but this was the data set that came from it. So you can see the first person on here had a 92% increase in their regional cerebral blood flow. And yet you have 8, 9, 10, and 11 who have between 0 and 4%, despite receiving similar treatment during it. Everybody had the same pulse rate, same frequency, same time, everything. So I find it interesting to see that there are some people who seem to respond and some people who didn't have any effect from it. So this raised the first question to me: is pulse rate an exact science? Is 10 and 40 hertz just more helpful? And maybe that's why these people in this study didn't have a response? Or is it actually just more about the fact that we pulse the light at all, and that's what's more effective? And is there real strong basis for the 40 hertz pulse rate with Alzheimer's? That's what we've been going with, but maybe is it just pulsing the light at all is helpful for it? So I wanted to get anybody's feedback on this first to start with. Is how do you feel about pulse rates and how do you approach this?
Yeah, I'm also curious, has anyone went beyond the realm of 40 hertz and tried other frequencies out and saw benefits?
Probably people aren't as much, it sounds like, but I think maybe this is an underexplored area. You know, a lot of it was around if we pulsed at 300 hertz, would we affect the P300 response? You know, I don't know, we're not really incorporating these enough. And my hope is somebody is interested in doing this, and maybe it'll be a good case study that could come out of it. So with the next topic is the idea of entrainment, since it goes right along with the concept with pulse rates and what exactly, if it's a science or if it's really just more about pulsing in general. So studies have shown that 40 hertz stimulation increases gamma wave activity. They also typically show that alpha and beta also increase, but we have pretty good basis for this occurring. But they also have showed that you have an increase in gamma, beta, and alpha when you pulse at 10 hertz or even constant light. So it doesn't necessarily seem to be that 40 hertz is making more gamma than the other waves, but more that light is just providing additional energy to increase the speed of the brain and the activity. I did add in here, just because I was curious about it, that the cadavers showed there's no difference in the penetration if you use constant light 10 hertz or 40 hertz, just in case that was going to be something that was a part of it, but the cadaver study showed it's all the same amount of how deep it can reach. But there was a study that was done in China. They did 810 nanometers on the forehead, specifically the right forehead, or FP2, and each person that was in it was assigned to receive no light, constant light, 5 hertz frequency, 10 hertz frequency, or 20 hertz frequency of the pulse rate of the light. So their hypothesis was that the faster the pulse rates, the stronger the response is from the area that's being stimulated. So they measured results of the EEG before, during, and immediately after. And this is what they came up with. So that top graph and the left side was looking at 0 to 2 hertz brain waves. The one next to it is 4 to 6 hertz. On the bottom left is 9 to 11 hertz, and the bottom right is 19 to 21. I found these pretty fascinating because you'll notice in both A and D, early on, the 5 hertz pulse rate had a stronger effect that was quite similar to the 20 hertz pulse rate. And as a person who has used lens in the past, we found that this can be the case despite 5 hertz and 20 hertz being incredibly different wavelengths. People can have similar responses. If they don't respond well to one, the other might be a good option, and vice versa. I thought it was also interesting here because you can see in both B, which is looking at that theta frequency, it's pretty linear in the way that it decreases. And in the alpha frequency, it's also fairly linear in the way that it's increasing. But in both the delta range and that mid beta range, it's quite messy. So it's an interesting thought of perhaps why we're having more impact that works this way, and what exactly are we doing here. This was the brain maps that they had for it. And so here you can see it was pretty consistent with their hypothesis. They stimulated the right forehead. The forehead had the greatest increase in energy. Went right along with what they had assumed would happen. However, there was another study that was done. And in this study, with a similar population, they were doing 1064 nanometer light, but otherwise they were doing it in the same location, same general population of 20-ish year olds, and recording with the EEG. What they found is that only alpha was increased during this. Gamma and beta were not affected at all. And they found that there was greater activation in multiple neural networks. So rather than only stimulating the forehead and directly underneath where they were applying the light, you see this network effect that's coming through. I think it's interesting too, because V-Light had their study and they were saying that they had the light over the default mode network, and therefore it made sense that it was more stimulated. But in this one, they only had light on the right forehead and yet still have stimulation of the default mode network. So it begs the question, is actually light what's causing this and creating these network changes, or is it really just about the idea that brain waves are training, and is there an entrainment aspect? And isn't it even entrainment if we're changing the network connectivity? So this was another thought that we had, because at Neuronic, we have a global ability to do global protocols or targeted protocols. And there's arguments for both sides. based on these previous studies. But I think is that there more power for us to target a specific area, or is it really just going to be the best approach to use global protocols? And I'm curious, for people who use our helmet, do you normally use global protocols, or do you typically focus more on one quadrant than another?
I mean, I think I've seen a lot of results personally with just global protocols. Obviously, we have the 4-quadrant feature, so you can tailor it a bit more. But I think overall, global protocols have been super effective just in general. So there are some people that need more of a tailored approach and only get those great results after having that tailored approach. But usually for most, global protocols are a good place to start, at least.
Yeah, thanks. I think too, one of the things that can be, an important aspect with, Patricia.
Basically, this is really interesting in the sense that with a global approach, you might not need a QEEG, that it would still give you some results, maybe not exactly what you want, but would be beneficial. And I think that's certainly a very important aspect for me, because I can't always get people to take a brain map. So, and I don't want to refuse treatment. So I would use the global protocol rather than a targeted approach.
Yeah, great point. Absolutely.
As you said, Patricia, it makes it more accessible to everyone as well.
Right. And certainly, I think one of the benefits with our helmet is that you can, give this to a cognitively impaired person to have them use, because we have presets that are set up so they can just put the helmet on, turn it on, and push a button. Being that easy to use, it opens up our audience so much more that maybe, not everybody needs a targeted approach with this. We have found that when one of our consultants, Roger Lee, is working with children, and especially young children, he does solely focus on the back of the head. There's not a ton of research, and certainly there's enough research to support that it's safe to use on the whole head. But that is one of the particular circumstances where you might prefer to use a targeted approach rather than a global one.
And also, in that perspective, if you have just one quadrant on, you decrease the dosage or the amount of light as well, so it becomes even more safer, you could say, from that perspective as well.
So in that case, could you do much longer protocols potentially if you're doing a targeted approach?
I think that's when you dive into complex territory there, Jordan.
This is what we're here for.
Exactly.
I'm gonna ask the hard questions.
Does anyone have any other theories or thoughts about that? It'd be interesting to gain other people's perspectives.
I was going to ask Phil if you're around. I see your name, Phil Toman. You've done a lot of experiments on your own. I'm just curious if you've played around with the different quadrants or usually use global approach. Oh, there you go.
Here I am. Sorry. I have not played with different quadrants. I'm like, there's so many parameters to adjust, and I've been sort of more interested in frequency, chasing down whether I get entrainment or not, and what are the sort of post-session impacts on the EEG frequency bands of continuous wave versus pulsed light. I've played around with that a little bit, but I don't want to manipulate too many things at once, so I've just been doing the whole helmet.
Can I ask, what frequencies are you using or have you looked at?
10 and 40, along with the continuous wave. Yeah.
Yeah, I mean, those are, I think, there's the most research that's on it, but that's where I've become so interested is, were those just chosen and now we've followed along with this research, or are they really the most ideal? More research is coming out on 75 hertz for different conditions or issues as well, but it's still so new. There's not a lot of validation yet. And I mean, I don't use 75 hertz, and so I'm always hesitant to recommend it to someone else, but that's not to say it's not beneficial.
Yeah, I think, I mean, to get certainty on this would require just tons and tons of parametric fiddling and lots of data with lots and lots of patients. And I'm not sure how long it'll take to get there. So for the moment, I think we kind of, my thought is we just sort of key off of what the published research is finding, maybe use that clinically and then maybe mess around a little bit, but it feels safest to just go with what people have published about.
Sure, absolutely. Yeah, Patricia.
Yeah, I harken back to sort of my roots in behavior therapy in terms of continuous reinforcement as compared to random variable. I mean, all of those kinds of things go into when I do neurofeedback or even using Neuronic, I still think about it in those terms because sometimes the brain just begins to get, okay, I don't need to have any more input to that. And when I did neurofeedback for the 25 years I've done it, basically I've always worked at altering things so that because I could never get a system that did random variable and reinforcement. So I did my own, so to speak. And I found that to be very effective. Maybe that was one of the reasons why I had really good results with just 2-channel training. I don't know, but that's my hypothesis.
Right, and you use Eager, don't you?
I do.
Mm-hmm.
Yes, I've used it since 1991.
Dad, if you heard that, does that mean that she's been using it longer than you?
I'm sorry?
My dad's an Eager user as
Oh.
well. He's on this call. I was trying to see how long he's been using
I'm
it.
sorry, 1998. So I'm thinking about when I got licensed. So I got it mixed up in my brain. I apologize. 1998 was when I became an EEG spectrum user.
Okay. Yeah. I've loved, something to me I enjoy with Eager is that you do have an option to tailor it a bit more. I mean, I like being able to work in quarter hertz, because some people did do better with 12.25 than just 12, and
well, that was my basic migraine protocol was 12.5 to 15.5. Don't ask me why it worked. It worked. That's all.
Yeah, Andrew.
So I was wondering if folks who are using Eager, if you've ever used the monitor settings, you can set it up so you're training 1 or 2 channels, but monitoring another 1 or 2 if you decide. I'm curious, that might get into some of this network effect stuff we're seeing when it's being stemmed here, but you're getting broad network effects. We might be able to do monitoring on related hubs. Like if you're doing anterior cingulate, you should maybe monitor them, hand waving. Wondering if we should be monitoring like the posterior cingulate, which is often connected, or the temporal lobes for that person if it's a tic or something. I'm wondering if folks have done any of that, because I've been sort of prepping to do QEEGs with the Neuronic device on top and trying to figure out logistics there and just to do some experimentation, but it might be easier just to do individual channels on big hubs. Just curious. And I've been using Eager for longer. I've been using Eager since it was called neurocybernetics, and you needed 2 different computers.
Oh God, so did I. That's when it started. Right.
Yeah, since 1990, I don't know, 2000. Let's call it 2000. Not as long as you, Patricia, and probably not as long as Ed either. So.
Well, I'm not playing Can You Top This?
Is anyone using the monitor channels? Is that just a random idea I'm having? Yeah.
I just found that simplicity. That's kind of been my main thing is simplicity, and I'm really concerned about any kind of overlapping kinds of things. I don't know which works and which doesn't, and I just wouldn't do that with my clients. I might have done that with me, but I didn't make time to do that. So, but whatever.
Yeah, I think it's interesting, and that's a great idea. I think that would be interesting to look at, but especially in terms of doing simultaneous recordings with the helmet, I think doing, just the single, 2-channel, but just single sensors is going to be easier because you're not going to block as much of the head and it'll be easier to get an effect from it. And yeah, I think that's a great idea. And I hope you do it and then share your data. Yeah, anyone else have any thoughts?
Just in response to Andrew's question, I frequently monitor alpha levels at PZ, even though I'm not training alpha. I'm training other frequencies, but I frequently have monitored that because I see a disproportionate number of over aroused people, and so PZ gives me a good measurement of that. So I've been doing that for years, and I started with autogenics back when neurofeedback equipment looked like stereo equipment. It came in cabinets, and things like that. So just throwing that in.
Thanks, yeah. And that's a great point too about monitoring the PZ and looking at the alpha. One of the things that I didn't include in this presentation, I get too many ideas and too excited, so I have to narrow myself down. But one of the things that we've seen on occasion now is people's peak alpha frequency increasing speed when it was already low after using the helmet for 3 months. So it's an interesting thing to think about monitoring, because you don't think about it being able to increase very well. And so getting to see those results is pretty fascinating. So I guess that's a good time for this of case studies and some preliminary analyses. So I was working in the clinic here in Asheville, North Carolina, when I first got my helmet last year, prior to working for Neuronic and doing neurofeedback. And I typically get the cases that are very complex and people who are going to be doing neurofeedback probably for life, which I really enjoyed. It was fun to be able to have that relationship, but also it was nice because they were willing to let me experiment on them. And I appreciate that a lot. So my first person that I used it with, he was an 80-year-old man. He had a couple of strokes. I don't know if any of them were major, but he definitely had some of those mini strokes. And he was diagnosed with mild cognitive impairment. Super, super smart, interesting human who was actually functioning pretty great. But I think anytime that your cognitive abilities start to fade a little bit, you don't feel very good. So he was coming in and doing neurofeedback. For him, I just wanted to test the waters. So I did 1 minute of the 40 hertz protocol. And then he went into his neurofeedback session. One of his issues is that he had so much high beta when he would start training. It would take 9 minutes for him to relax finally enough to really start getting some of this in. But the first 9 minutes were mostly just getting rid of this muscle tension. So it was a little frustrating because he'd been coming at this point for years, and he still had that where it took at least 7 to 9 minutes to be able to get his high beta down. So we did this 1 minute 40 hertz protocol, and immediately in his neurofeedback session, his high beta was low. And by low, I mean, it was around, 5 for his protocol of C3 minus C4 or something. So it was a pretty significant shift from his normal training. But afterwards, then he said he slept for 4 days. Sometimes I think people think that's a bad thing, but especially if you have sleep problems, I think that there's actually a really great homeostasis that's coming back online to try and reorient you. So I didn't take it as a bad thing, but I also did not put the helmet back on him. My other person was a 53-year-old woman. She was diagnosed with major depressive disorder, definitely had some undiagnosed anxiety though as well, and chronically low alpha. I tried every single possible protocol that I could think of to help with this, but every time it was like pulling teeth to get her alpha to move at all. But she was also a really great trooper and up for letting me experiment with her, which I'm, again, very grateful for. So I got to use the helmet on her for a couple of sessions. I tested her out and started her slower, but we settled on doing the full peace protocol, which is 10 hertz pulse rate, 25% duty cycle. And yeah, after we had built up to the point where she could do the full session, her alpha significantly improved at the very beginning of our neurofeedback session. So I used it immediately before, and then we would, and I would just do the talking and catching up with her at that point in time. And then we would get into our session. And it was such a amazing relief to me because I'd also been seeing her at this point for maybe 4 years and could not get this alpha to budge no matter what we did. So having this improvement immediately after the helmet was a really exciting thing to me, which only increased my excitement for research, which doesn't take much, but it was pretty neat. So I started looking back at some of the data that we have here at Neuronic, and it's a small sample size, but it was pretty exciting to me anyway. We had 23 individuals. Their ages were from 5 to 85 years old, and their issues varied from issues with depression, issues with anxiety, issues with cognitive impairment. I mean, autism, just a wide range of issues that people were wanting help with. The protocols varied all over the place because everybody has sort of their own approach to protocols, and they all seem to work. So it's neat to be able to see the variety that people implement. But looking at these, I started to see a trend pretty easily, which goes along with a lot of this research. People who had a ton of high beta seem to have a decrease in that once they had their follow-up QEEG. People who had a ton of slow wave activity seem to have an increase in the speed, a decrease of that slow wave. And then people also had an increase in their total voltage. So I broke down those numbers here, and it was pretty interesting just to see these. Their protocols had no uniformity about them. The profiles of the people had no uniformity other than these QEEG markers and activity. But yeah, otherwise there wasn't anything that you could relate between people. So to see these kinds of results that they pretty easily fit into these categories was something that I found really exciting. But it also brought up the question of, if somebody has, particular profile of excess delta or theta, and I give them the exact same protocol that I'm giving somebody who has excess high beta, and we're getting the opposite results, but where they're meeting in the middle more, is light just helping promote the general homeostasis. And so it's not necessarily a 40 hertz will help speed somebody up and 10 hertz will calm them down, but maybe just having a pulse light inspires the homeostasis of the body. So yeah, it was interesting. So I'm curious if any of you have worked with clients who kind of have similar profiles that you've seen with this and you've noticed changes after using the helmet, or if there's particular protocols or people who seem to respond better or you get better results with. Which I know Nicole has a sort of opposite approach than I do for some of this and has seen quite a few people. Have you noticed any of these trends that 40 hertz does seem to be helpful in stimulating and 10 hertz seems to be specifically helpful in calming?
Yeah, definitely. The psychologist I work with here, she does neurofeedback as well. And she bases her protocol for PBM. She uses the preset and she'll just kind of base the protocol off of how they come to her rather than, unless they're taking the device home, then she'll base it off of a QEG. But if they come to their intake before neurofeedback and they're super agitated, then she'll use peace. If they're a bit more brain foggy, then she'll use 40 hertz. So it's kind of how they present to her rather than just their diagnosis of anxiety or, TBI or whatever. So yeah, that's one approach that she uses as well.
Yeah, I think that's a great point. Like with my client who was diagnosed with major depressive disorder, but I was using 10 hertz on her because despite this diagnosis where you might think you're wanting to be a little more stimulating, I felt like the way she presented was certainly the anxious type with it instead, and that maybe a calming protocol was going to be more ideal. And like I said, I saw results with it as well. But yeah, I'm curious if other people have seen other opposing results.
I think I've heard at least 2 clinicians tell me that they found similar to Nicole, that the 10 hertz seems to be more calming and the 40 hertz more activating, but I'm curious, if there's been an opposite response.
Yeah, and I'm also curious if if anybody here has tried the 40 hertz protocol themselves. I know Nicole enjoys using it and gets really great results. And for me, I walked back and forth in my house 100 times because I kept setting things down and forgetting it. And then I'd have to go back and get it and set something else down for an hour afterwards. So I avoid it. Yes, Patricia.
Yeah, I've been using 40 hertz almost exclusively for years. I think I now perceive it as sort of nutrition for the brain. And so it sort of keeps my recall even, because when I don't do it, I notice that my recall begins to recede. And it's just good. So as I say, I use it like nutrition.
Have you ever tried any of the other frequencies and then found the 40 hertz to be best, or you found what you liked and you stuck with it?
Well, I started with the 40 hertz because of the recall issue.
Okay.
And basically I've just stayed with it. I have recently added 10 hertz for pain management to see if that can help me with my pain in my legs. And so the jury's still out where that's concerned. And I don't do it every day. And I don't do it twice a day ever. I never have done it twice a day. So, but I still use it. And now I'm also using the 10 hertz on my knee specifically, as well as just a general use of the helmet. But unfortunately, I don't have I don't have a private practice for biofeedback anymore. So I don't have to get a chance. I don't get a chance to mess with my clients as I would have in the past.
Yes, yeah. Well, great though. I'm glad you found something that's helping. Yeah.
I did try all of them on me, Jordan. I wanted to have the full experience. And it was really an interesting experience because when I did the gamma, that was the one that I had the strongest reaction to, and shared it with some physician friends I have here. I literally I went to the gym right after doing it, which was probably not a great idea because I was about walking into walls. I forgot where my car was. I left my bag. I almost walked out without my shoes. And I was like, I think probably I shouldn't be doing gamma on me very often. And on the other side of that, the alpha is calming, but I'm really accustomed to that because I use the alpha stim with people like you do. And then the beta I found really helpful in a very specific way. When I have a long list of really necessary, boring things that I need to do, the tedious detail, I get really resistant. It's like, I don't want to do these things. And if I treat with beta, I don't mind doing it and my list just gets done. So when I have a long list of, I really don't want to do this boring stuff, but I really need to do it, on occasion I'll treat with beta. So those are.
Your beta is 14 hertz, right?
Yes.
Oh.
And so I just did try everything. And I think it really helped me to have a sense of if patients are overstimulated, what that might look like, since I had some of those experiences myself.
Yeah. Yeah. Always good to test it on yourself first, right?
Very interesting.
Oh, thanks. Yeah, Nicole.
Yeah, just kind of echoing what a lot of the other thoughts are. I think with 40 hertz too, we've noticed that it's been both like directly cognitively stimulating and also physically stimulating too, like in terms of initiating activity. So I had one client who's started using a 40 hertz protocol and she started cooking again, which was, she has Alzheimer's diagnosis and she started cooking again for the first time in years is what her husband said. And then Jordan and I were just on a call with a doctor out of New York, and she was using it with a Alzheimer's client who's pretty far progressed as well. And she started, after using the 40 hertz protocol, started getting out of her chair and interacting, making eye contact with her nurses and aides. And even the doctor on the call was like getting emotional talking to us about it because she was just so much more mobile physically and then cognitively more present as well. So I think there's that physical side to it as well. Yes, of course, there's that direct like memory improvement and clearing of brain fog, but I think it's also more stimulating in those like physical aspects as well, which obviously is a result of better cognition as well.
Yeah. And that's such a great point because, of course, being able to also be physically stimulating, if these people are able to start moving more, it's going to be better for their overall wellness and lets them stay involved in life more and longer. It's an important point to bring up. So yeah, thanks for that. So my last topic that I had was about combining therapies. And I think about this more and more. I mean, every day being here with Neuronic, but we work with such a wide variety of providers. You know, quite a few of us are neurofeedback providers, but we also work with functional medicine doctors. We've started working with more physical therapists. And I know I've left things off from this one, but it's exciting to start seeing more of these different types of providers with different approaches using the helmet. I think there's good evidence that it fits in specifically with any of these modalities, you know, from having oscillatory changes in the brain, having positive impacts on mitochondria. I think there's, you know, no end to what photobiomodulation can be combined with. So I started looking into this a little bit more. And one of the things I think will be interesting, and I hope we get the opportunity at some point to see this, but combining photobiomodulation with IV therapy, there's a good enough evidence, I think, that it can improve possibly the absorption rate of nutrients if you're getting IV therapy, or possibly the absorption rate of medicine if that's a positive thing for a person's particular situation. But yeah, I think that it would be an easy thing as well to implement, since you're not having to do, you know, two things at once, like when we're trying to hook up neurofeedback sensors and put a helmet on. It's a little more difficult, but if you can just have somebody sitting with an IV in their arm and you put the helmet on there, they're already sitting there and stay stationary during that time. So I think that there could be a lot of really good opportunities for that I hope we get to see. Photobiomodulation and magnet therapy. This was not something that I was really sold on until we had a client at our clinic who had a specific type of brain cancer that I don't remember now, but he's been using magnet therapy to treat it. Not just he figured this out or something, but it was recommended to him from one of his providers. I thought it was a fascinating concept, so I've gotten a little more interested in it. And I did find one article that was looking at intravenous photobiomodulation, chromotherapy, specifically with yellow and green light alternating, and then magnet therapy with it, and looking at it for helping people with Alzheimer's. Now, granted, this was in 2005, so the drugs were very different then. So I will put that out as a disclaimer. However, they found that compared to the most popular drug out at that time, and this combination of therapies, that the rate of progression was significantly slower with the therapies versus the drug that was out. And they definitely have improved in their drugs and are getting better all the time. So I don't know if this would still stand up today, but I thought it was pretty fascinating. And thinking about the idea of just the colors that you look at on a regular basis could potentially be having an effect on your mental health is just always an interesting thing to me. So I'm kind of hoping to see, maybe that'll come out more so as well in the future. And then I really am a big fan of people just spinning in circles for their health. It's a free thing that they can do. It's helpful for your vestibular system. And I think that's something that photobiomodulation can go hand in hand with as well. I know it sounds really silly for it, but I do genuinely think there's a lot of true evidence of why this could be something that people could do to encourage and support their brain health. Getting this vestibular activation is so important for reducing fall risk. Especially the older that you get, the more that vestibular system is breaking down. So maybe we should just, spin people in a chair sometimes while they're doing their photobiomodulation and get some more activation going on. I think that, it potentially could be helpful. So I did make a public service announcement for this, and I stand by it. I think that it's just always a nice thing to have a free option for something to combine with photobiomodulation that could also be helpful for the way that we age and our general brain health. So, yeah, Patricia.
Yeah, what I've been doing in the last few months is I've been going to an energy field where you sit, there's monitors in all four corners, and you sit in nice chairs and whatnot. And people very often just put on a mask, but I've started just looking at the monitors because there's four monitors on all four places to see whether this can affect me in any kind of beneficial or positive way. And I'm of the opinion that the brain, it takes a while to change. It doesn't do this. So sometimes you get an immediate effect, but it may only be a honeymoon effect also. So I'm really in the third 10 session. I'm about 35 sessions. And so my goal was to see if there was any differences that I could discern after about 40 sessions. And then I would keep on going, or I would stop because it was not necessarily, because I found even with neurofeedback, sometimes between 20 and 60, just for ordinary kinds of problems was needed. So it wasn't, which I was originally told by the Othmers, that if you didn't have any benefits after 10 sessions, it didn't work. I didn't find that to be true. So in any case, I will keep you posted on that because it's a very interesting notion, I think, of this energy field. It's just that I spend 2 hours a week doing that. So I either write my book in my head or I meditate, or I have also been doing self-hypnosis while I'm sitting in the chair. So it's just a very interesting new idea. I kind of wish I knew about it a long time ago, but that's it. So I thought you might be interested.
Yes, absolutely. That's fascinating. Wow. Yeah, well.
Yeah, no, I was gonna not necessarily add to it, but I think a recent study came out saying that the way you sleep, depending if you sleep in north facing compared to east facing, that it changes your EEG activity. Crazy, in my opinion. You know, the way you sleep, you know,
Well,
is
it may have to
effective.
do. It may have to do with how these invisible waves are coming into us.
Yeah.
Who the heck knows?
Yeah.
Wow.
And I imagine if you're sleeping next to a smart meter or there's something behind your apartment or a house, it could be quite interesting impact on your EEG.
Well, I have to have my phone next to me, so I put it in one of these RFD things so that I would not get the radio waves, though. Whatever. So I hope
Nice.
that doesn't affect my sleep.
Yeah, I know that's something that Mike Cohen does at his center, is that, you know, and people, I don't remember exactly how many sessions, but like at a certain number of sessions, if people aren't having any changes or shifting at all, I think he pretty regularly will test for electromagnetic fields in the, you know, whether it's in their room where they're sleeping or it's in a place where they spend a lot of time in their house, because he was like, it's often that, and these people are just not able to change because they have so much influence from it. And then he recommends, you know, things to help cope with that. So I think it's a real thing that people don't think about a lot, and almost all of us have our phone next to us all the time.
Well, Rusty Turner, the pediatric neurologist, gave a really excellent presentation on radio waves and stuff like that, and warnings about many of these things. I find that sometimes these things are a little more stimulating than I would like them to be, because I don't want to get into worrying that that's something that's really over affecting me in some way. But that doesn't alter the fact that I did put this RSD cover on my phone after that.
I see. Okay. So in this energy field that you're in, though, is that not a stimulating thing? Is the energy like contrived in some way so that
I don't know. I really, I don't know enough, Jordan, to be able to use the language. I know that it has to do with the energy field that's past the energy fields that we use. Scalar technology, whatever that is. And there's a really excellent YouTube presentation that I watched that gave me a little more information. The problem with that is I have to watch it 4 or 5 times before I really begin to absorb enough to be able to speak about it with any kind of sense. But it's really quite interesting. And so I'm just sort of not making any judgments about this at this particular point in time. I just want to see what it is. Anything that I think helps us maintain a better physiological cognitive state I think is great.
Absolutely. Yeah. Throw everything at it is my feeling. Absolutely.
But then you don't know what you really need to do it. I worry about confounding variables
That's
a
true.
lot. And so that's one of the reasons why I don't usually do put a lot of things together. But that's me.
Yeah. Okay. I like that approach too. Then you know what's working or not.
Yep.
Absolutely. Yeah, Linda.
Well, around the energetic part, about 18 years ago, there was actually a Russian scientist that presented at NIH around a device called a GDV, which mapped the human electric field. And they were considering doing research on this on cancer. And that was the area I was researching at the time. So I was invited and actually went to Russia and trained with Konstantin Karakov to learn to use his instrument, and brought it back and began working with it here, and actually did, just for my own entertainment, looking at our traditional healers and how their energetic field changed when they were doing healing services, and how the person they were working on, how it changed. And it was showing really promising results. And then, not surprisingly, NIH wanted them to sell the rights to their device to someone in the US, and that was a deal breaker. Russia was not willing to do that. Karakov is not going to do that. And so NIH just dropped it and walked away from it. And at that point, you know, it really couldn't be used medically. So except for my own entertainment, I didn't use it anymore. But it was really a fascinating device, and it worked off looking at the acupuncture points and mapping them throughout the body. And you could see changes where cancers were developing faster than typically would be diagnosed, and it had a lot of promise. But we run into these different cultural political issues that frequently stop us from doing very interesting things. So at that point, I let it go.
I know you're also interested in structured water, right?
So you're going to show my weird side now, Jordan. Yes. Also, a long time ago, I met a scientist named William Tiller at a conference, and we were going to replicate some of his work, working with human consciousness, mapping people using heart math, Jordan, to really show they were getting into those depths and changing the pH of water at will. And we actually had set it up. We were going to do an at-distance lab with Dr. Tiller. And that was right after that my husband was diagnosed with cancer. So all of that stopped for many years until my husband's passing. And recently I have sort of resurrected that, and we're just beginning to play with it. And one of my physician friends actually did some of her research in the unique properties of water. So I may decide to do some more of that for entertainment value. But the thing around the electromagnetic fields, I think that's very real. I mean, I know it's real. It's just how would we actually harness that, think about it in ways that provide the best benefit, and then getting the scientific community to take that seriously, that's a whole new issue. But actually, one of my associates from MD Anderson Cancer Center is actually beginning to do research with those exact topics, which stunned me because he's very, very careful to be very conventional. And so when I told him about the Tiller studies, I was looking at again and sort of laughing and saying, so do you think I'm ready for the white coats now? He pretty much said, well, let me tell you what I'm working on. And it's like, oh my gosh, we're all, going to these interesting exploratory areas. But his view was, as long as we're doing it really rigorously, you need to be bold and do it. So I'm sort of feeling more confident in at least thinking about these things.
Yeah, Patricia.
Yeah, there was Neurofield for many years did electromagnetic, whatever their pulse electromagnetic field stuff on water. I did it some of the time. I didn't notice any different, but I don't think I did it long enough to make a difference. But I think they're still using it, but I really don't know, because I had to get out of that. It just got too complicated for me. I'm a simple clinical psychologist. And so therefore, it was a little more than I could. You have to really be in it, use it, and be immersed in it. And I just could not do that. So I had to get out of it altogether. But I'm sure they still do it.
Yeah, I think it's such an interesting topic because I really didn't know much about it. But in fact, it was in this exact group about a year ago, or maybe even a little bit longer, that it was brought up in all of these different stages of water and all the different kinds of things. And I felt quite confused at that time because I was pretty sure we were supposed to be talking about light, but it was so interesting. And now I found all of these people who are really interested in this, and there seems to be some good evidence with it. It's a wild concept that I definitely don't know enough to speak on at all, but it's really interesting. And I'm curious to see how much more will come out the more that these alternative thinking and ideas are going to be accepted, hopefully, in the medical community.
There's a lot of things that work.
Yeah. Well, I appreciate all of you being a part of this. I was really excited to lead a discussion around topics that I find interesting and hear people's thoughts. It always sparks more excitement in me for being in this field and being a part of this group. So I really appreciate everybody who came today and who sat through this and, accepted my public service announcement. Thank you all so much.
Thank you, Jordan. We really appreciate that. It's a great discussion. And just in the chat, Alyssa has put some of the references that were in Jordan's presentation, if you want to grab any of those. But again, the presentation will be sent out in a recording in about a week or so. And for the next presentation is September 5th. Dr. Fred Schiffer will speak, and we'll see you guys next month. Thank you so much.
Thank you all.
Thank you, Jordan. Thanks, everyone.